we all need to take a bit of time now and determine how we're going to collectively move forward. All parties now need to carefully reflect on the next steps. But most importantly, I want to reiterate to Ontarians and reassure Ontarians what matters most. That people and patients can be certain that their access to doctors and the healthcare system will not be affected. And I would expect that everyone, including the OMA and the concerned doctors of Ontario and others, would agree with me on that. The government wants Ontario's doctors to be and to remain well paid. That's why we suggested an increase of more than 10% over the next 4 years, 2.5% each year. But we've been told that that's not enough. So what is? 5% a year? 10% a year? Those on the other side of this argument will need to tell us what they think constitutes a fair increase. And as the Minister of Health, I have to tell you, a choice between keeping doctors well paid and expanding home care for patients versus even more money for doctors at the expense of home care, mental health services, hospitals, and public health isn't a hard choice to make.
Are you worried that a small number of very vocal doctors may derail this?
Well, you know, I think that it's important, and I've said this already, to respect the decision that was taken by the OMA membership. I think it's unfortunate that the turnout wasn't higher than it was at 55%. But that being said, we should all, and certainly it's the position of myself and the government, to respect the democratic decision of the physician membership of the OMA. That being said, there is clearly a lot of work ahead for all of us. But I believe that taking a principled approach and a collaborative approach, I mean, you can look at the past as you wish, but this was not a failure of government. We negotiated with our partner that we had, the OMA, which we're contractually and legally required to do with them and with them solely. We reached an agreement with the OMA. The OMA failed to obtain the majority of their membership in support of the agreement.